People in Yemen saying, we used to run out of anesthetic, now we don't. We're getting people numb that could never get numb before. We're in the trenches in Uganda, oral surgeons saying, all my dentists need to learn this. Like, this is really good.
Hello, everybody, and welcome to the latest episode of the Raving Patients podcast, sponsored by Cloud Dentistry and DocSites. So during this episode, you'll hear a little bit from our sponsors, but I couldn't be doing without them. Today's episode, I'm really excited about. I was recently a speaker at the Maverick Summit in Austin, Texas, and I was able to meet a gentleman. He's a fellow dentist. He created a product that is changing the landscape of your practice. Today's episode is called A New Era of Dental Practice. And as you listen, you're going to learn how a simple intraosseous injection is going to help accelerate and enhance the doctor-patient experience. Today's guest is Gregory Tuttle from TuttleNumbNow. Greg, thanks for joining me today. I look forward to spending the next 30 to 35 minutes with you and really explaining what your product does and how it helps dentists. But thank you for joining me today.
Lynn, hey, it's a huge honor. I'm a big fan of your podcast, and the raving patients are raving about NumbNow. When we went to the Dental Maverick Conference, the organizer used it. One of the leading speakers uses it, and it was a pretty easy sell. I'm a full-time practicing dentist, practice in Sacramento and in Utah. I have developed this for dentists and for patients. So thanks for having me on today.
Thank you for joining me. So let's get right down to it. So for those that don't know who you are, and as we talked about, a lot of people don't know about the product, so this is a little bit about brand awareness as well. I want to get the word out there. For those that don't know what TuttleNumbNow is, can you spend a couple of minutes talking about that first, just what the product is, and then I'll have you introduce yourself in terms of who you are, where. I know you have you sold a practice in Sacramento, but we'll go over a little bit of your bio as well. But start off by telling people immediately what TuttleNumbNow is.
So TuttleNumbNow is a complete revolution. It's a complete rethinking of local anesthesia. I encountered a patient one time that had a tough to numb tooth, and I was dumping in the cartridges. I did my block, I did my long buckle, I did my PDL injections, Stabident X-tip, was on back order. I went to get an X-tip, I couldn't get it. Finally, I figured out how to get a 30 gauge needle into bone. And so I instead of ending with that as a rescue injection, I learned to get a 30 gauge needle into bone and make it as a primary injection. And through the development of it, a lot of great miracles and developments and associations with other product companies. But the actual product is so that I don't have to go and lecture to everyone. These dentists can order it online at TuttleNumbNow.com. They can instantly download the videos. There's 50-minute videos, short video clips, 4 minutes on anteriors, 6 minutes on lower molars, 9 minutes. And it has a incremental syringe in it, which we've designed for each injection, because we don't just dump multiple carpules. We dump in just incrementally different injections and advise on what type of anesthetic to use, carbocaine, septicaine, proper use of it. Anyways, in the kit comes with a needle bending guide. These were developed by Septidont and myself. We have a patent on it. And sample needle guides are in the kit. Incremental syringes in the kit. A color booklet is in the kit. Video download, and everything you need to just spend an hour and then jump right on it. Step-by-step cookbook, not a textbook, to be able to get on it and take care of the patients right away.
Perfect. So now let's briefly talk about who you are, what you do. I know, so you practice in Utah. You had sold a practice in Sacramento recently, so you now have only a single practice in Utah. But give the listeners and the viewers a little bit of a background of kind of how you got into this, how you decided to take a different career route, hopefully, and do more on the patient experience part of it. Why you developed a product like this?
Yeah, so I was practicing when I started out in Sacramento. We had 2 chairs. One doctor had 1 chair, and I had a chair. And I was like, all this work that's there to be done, like it was clogging up the schedule. How are we going to get through all these people? And he stressed out and sold the practice out to me. And so I was a brand new doctor, and I had 2 chairs, and I had a 30-year-old practice, and I should have probably expanded my office, but I had to learn how to work fast and get things taken care of and get people numb now. So that just extrapolated into being busy. In '03, I had my eureka moment where I actually penetrated the bone, got in, and I started to say, why do the block? Why do these other injections? Let's start right out with intraosseous injection. In 2011, a new needle came to the US that I found out about. I didn't discover it, I found out about it. The Evolution needle is 29% less force to penetrate, and it made me get into bone better. It was designed to go into bone. I found out it's called the osteocentral or the transcort needle in France, and it was made to go into bone. So where the Evolution needle was designed to just give infiltrations, it's a lance and it chops and it cuts. So it really enhanced my technique, and then I started using that exclusively on every patient. So practice in Sacramento, then I started practicing in Utah, and I literally could do what other dentists were doing in 7 chairs, and I literally tripled my net income off of all 3 of those practices that I've acquired by doctors turning their practices over to me or me buying them initially. So
is that simply by making it faster to administer an anesthetic and not having to wait all the time you need to get started with the patient?
Yeah, so not only faster, but I can work in all 4 quadrants. If I'm not numbing a lip, I don't have to just work on half a mouth. I can work on the entire mouth. I can work here. I can go in, do my intraosseous, do a crown prep on number 30. Then I can jump over to the other side. How'd you do? Good. Everything went good. Temporize it. Everything to completion. Do you want to do the one on the other side? Yes. 20 minutes later, you jump onto the other side, numb, prep, temporize, impress, whatever you need to do. And then you can work in the entire mouth and not just half a mouth. When I jump over to do a hygiene check, I can jump over there and say, hey, we still have 15 minutes. I can numb that lower first molar. I can do an occlusal, a few fillings, and just efficient, effective use of my chairs, my scheduling book, and my dentistry. It's just light speed. It's better.
Makes sense. So I want to talk a little bit about, how this product or how this technique obviously differs from traditional anesthesia. Because obviously we've been doing the same thing forever. We got taught in dental school how to administer a block, infiltration, all these other things. And there are patients who do take a significant amount of time to get numb. I think maybe I can count on less than one hand how many times I literally could not get someone numb. So it's maybe 5 times in, 22 years. But obviously it's not a comfortable experience to happen to you. So talk about how a traditional, for those that really don't understand it, because it's still a little bit behind it, how traditional anesthetic compares to what you're talking about here with TuttleNumbNow.
Well, traditional anesthesia, they teach the block, they teach the infiltrations, they teach PDL injections, which only last about 12 minutes, and then the tooth distends, and it's sensitive afterwards, and the patient comes back, hey, why is it sensitive? Well, the tooth distended because we added all that pressure into the PDL space. So this differs in that it's going into the cancellous bone like a Stabident or an X-tip. They had a meeting at the American Association of Endodontists in 2016 on hot teeth and tested systems and found out that X-tip was the most effective, or Stabident intraosseous was the most effective on hot teeth. However, due to the difficulty in the armamentarium, the cost $10 per application, and perforator separation, root damage, and risks that were involved in it, a backflush of anesthetic, that it was not recommended as a primary injection, and due to all those host of factors. So I was able to eliminate all those using a 30 gauge needle to get in, and I was able to numb instantly. No root damage, no porter sleeve, no drilling into bone, getting in the 30 gauge needle. So all those went away. And so with those going away, I could use that as a primary injection, especially on lower first molars. It's the primary injection of choice on lower first molars.
So let's talk about the process here. So patient is in hygiene. You say, let's do a lower first molar. How long does it take you from the time you anesthetize to the time you can actually start treatment?
We've learned a lot from some of the C-clad machines, like the STA machine, on how to give a pain-free injection. So it walks you right through 10 steps to get into the bone and give the primary injection. So it takes a little more time than just jab and squirt. It's not like that. It's a finesse. It's a two-handed technique, almost like bunting a baseball. You have control, and then you have the needle guide on the tip, and you bend the needle at a 90, which some docs said you cannot bend a needle. Michael Glick said you cannot touch a needle. Malamed says, I've always been against bending needles, but Tuttle, what you've done is very compelling. We ended up making a bendable needle system that was acceptable. Septidon said, I've challenged my engineers to come up with a bendable needle system, and Tuttle, 3 years ago, and Tuttle, you did it, so we're going to take on your project. So we helped develop the needle guide. Anyway, so with the hygienist, once again, back to your question, I go in, I bend my needle at a 90, I follow the TNN protocol, boom, injection, set down the syringe, pick up the drill. It's going to probably take, per quarter of a cartridge is about anywhere from 20 to 40 seconds. And a lot of times a quarter of a cartridge will do it. Sometimes mesial and distal, but it coaches you right through on how much to give, what to give, and how long it takes to give it. Obviously in a child where it's going to take less time, or the porous bone, and other people, it's going to take the full 20 to 40 seconds to deliver a quarter of a cartridge. But once you're done, you never wait. The beauty of this is you set down the syringe, you pick up the drill and go. If there's still cold sensitivity, you go on to step TNN2, TNN3, TNN4. TNN9 is a PDL injection. TNN10 is a Gal-Gates block with carbocaine. But so hopefully you don't have to get to that, but it's reversed the entire sequence of what to give first and what to give next. And there's no guesswork. It eliminates all that. So I sit down in that hygiene room, 2 minutes to numb, 7 minutes to fill, bingo, they're out. Didn't clog up the appointment book, and we just produced out of that hygiene chair.
Now, in terms of the process of doing this, can you talk about a little bit on the technique side? Obviously, people here, they're injecting into bone, they're perforating the bone. Can you just talk a little bit about the actual technique here so people kind of understand and I don't want you to go into a long drawn answer here, but literally I know you just talk about the steps that are involved, because I'm curious. The longest part sounds like the actual injection part, and you can get started right away. So it's just learning how to change the way you're doing things in the office. So talk a little bit about the procedure itself.
So the procedure itself, when I first came up with it, I'd have a doctor looking over my shoulder saying, and watch me do it. And he couldn't do it. And so I said, I think we need to come up with steps. So I wrote these down on Taco Bell wrappers or whatever, napkins, and I gave it to this guy, and he went into Evernote and he put it together, and he goes, Greg, there's 20 steps to get in. And I followed your 20, he was a dentist. He goes, I followed your 20 steps and I finally got in. I've watched you do it all the time and I just can't do it. But then I watched your 20 steps and it's kind of counterintuitive. So step 1 is you got to have an exact target. Step 2 is you would have the right anesthetic. Obviously, there's Septicaine, 1 to 100,000 epinephrine, and we use carbocaine. Step 3, exact, precise target, and it's imperceptible penetration, the bevel only, 1 drop. Wait 5 seconds. Advance to the periosteum, 1 drop. 5 seconds. So if you have a rusty clunker old syringe and you're trying to deliver 1 drop, it's really hard to do. And that's why I like a very nice, smooth acting syringe, and we include a syringe in the kit. And then you advance to the periosteum, and then there's a series of angulation changes and bumps. And finally, boom, on about the 4th angulation change and bump, it enters the bone. Then you're going about 1 millimeter per 5 seconds as you advance, and we take that needle all the way to the lingual plate. That needle is penetrating roughly 8 millimeters all the way through into the lingual plate. And a low pressure, low volume, you start out with low pressure, low volume, you end with moderate pressure as the tissue blanches responsibly. The people that don't follow the steps or just go in there cavalier and try to blow it up, they end up with focal tissue necrosis and some problems. So this is trying to coach it through responsibly so you don't have to painfully learn what we already know after doing this for 30 years or 20 years is what I've been doing.
Gotcha. And now one last question on the technique. How do you know the exact location of where you have to inject?
Yeah, so it depends. Like, for example, you draw a line from the caul or the cemento enamel junction straight across, and then you bisect it. And so you're going into supracrestal bone, but it's not really a supracrestal injection. It's not really an attached gingival injection. It is an intraosseous injection. We know that from the outcome as we compare it to X-tip and Stabident. Obviously, there's instructions in the booklet, like as far as if there's supracrestal bone loss, what to do. Obviously, you can't do it in a perio defect when they have 8 millimeter pocket. You can't go in there to the crestal bone and blow it up. You're going to do your complementary crown lengthening right there as the tissue sloughs. So it guides you as to what's a safe site and what's not a safe site, and it's pretty basic. You're going to take every injection you already know, and you're just going to add to it, but you're going to reverse the sequence of them, and you coach through to get it going.
Before we go into myths regarding anesthesia itself, can you talk about, you mentioned it already a couple times, but can you talk about how this compares to Stabident and X-tip, which obviously, I used Stabident many, many moons ago, but I heard it's not available anymore. So can you talk about how this product compares to that or to those?
Yeah, so this was birthed out of my frustrations with X-tip. I couldn't control how deep the needle was. I couldn't tell if it was back flushing out or going into the cancellous bone. It would save me. The X-tip advantage of the X-tip is you can go down on the unattached gingiva and put your port in. So X-tip still is in business. I still have them in my office. There still is a place for it because my injection is a little bit higher than it's in the attached gingiva, supracrestal bone. X-tip costs $10 per application. You have to drill the port and sleeve, and then you have to pull it out. This is no drilling, and you're taking a 30 gauge needle, so you can't do the damage. The cost is way cheaper, and X-tip is only reserved for a difficult to numb tooth. And I use this as a primary injection. I use it every single day. My favorite application for it is I'm placing a crown on number 30. What does everyone do? Oh, I don't want to give a block. I know I can just pop this off, a little cold air, a little bit of, and then they suffer through it. With this, I can go in, probably the same hole I generated the first appointment on the prep date. I can administer a little bit anesthesia just in a matter of seconds. It doesn't take the full minute this time. Just in a matter of seconds, I can set it down. I can pop off the temporary. I can hit it with air and water, and then boom, confidently cement a crown in a dry environment and not hurt the patient. And because you ask them, do you want a crown on the other side? And they're like, no, I don't want to do that again. That hurt, So when we hurt them, they're not going to want to do stuff. You don't hurt them, they're going to want to do stuff.
So I learned very early in my dental career, actually in dental school, that if you can give a painless needle, patients will flock to your office. And when I heard that, I actually have learned how to give a painless needle. I just use, just a compounded topical gel, and I use I use Sitness plain as my injection, as the initial injection, Sitness 4% plain. And then I followed up with a carpal of either lidocaine or septicaine, depending on the area I work with. Obviously, it takes time for the patient to get numb, but it is a painless injection, and the patients really appreciate the fact that I do that. But what you just mentioned when it comes to the crown prep appointment or the crown cement appointment, I think that's a perfect application for this on top of the other things you talked about. So it just triggered in my head a great way, because we don't numb patients normally during their crown prep and crown insert, but they do suffer a little bit when you blow the air and they're like, so let's talk about myths when it comes to, or myth busting anesthesia. So talk about some myths here that exist.
Well, like I said before, they said don't bend a needle. Then you ask an oral surgeon, he goes, well, I curve them, or I bend them, but I don't bend them back. But, as far as access, visibility, if you're going to give a mylohyoid injection, you want a curved needle, you want a bent needle or something. This allows you to bend it responsibly. And if I was going to ever get this into schools and worldwide, I needed to have a system to responsibly touch or bend the needle and recap it as well. Recapping a bent needle, it just sleeves back on itself. It's perfect. It's safer than the scoop technique. It's safer than anything else. So the myth 1 is don't bend a needle. Myth 2 was if you give an intraosseous injection, they're going to have tachycardia. Well, that's based on a study from Canada where they gave 1 to 80,000 epinephrine and they delivered the entire bolus all in one dosage. You do not, when you go with an X-tip and you deliver the whole dosage of 1 to 100,000 even, yeah, they're all going to get tachycardia. That's not a bad thing, but you got to learn how to control it and manage that. Other myths are that you can't get into bone. And it's like, yeah, this needle was made to go into bone. And yes, I've been getting into bone since 2003, and it's a better way to practice. Think of it even as far as a bleeder. You got someone on Coumadin. If you go in there and with a lance needle and you're redirecting and you're going up there and giving a block, you're piercing 2 muscles. You're going up by the joint capsule. You can get a chance of hematoma. If you can just go IO, I've got 1 little needle hole that I can plug up with my finger in the attached gingiva. And I'm rambling here, but there's a lot of applications. There's probably 100 different advantages to doing this. Checking the bite, the tongue doesn't get in the way. They still have some proprioceptive on checking, so you don't have as many high fillings to adjust. You can get accurate impressions. It also blanches the tissue so that you don't have as much bleeding. I rarely pack cord, which is a huge advantage because of the blanching. Other myths would be that, I covered most of them. You can't get into bone. You can't bend a needle. You can't do IO. It's too painful. IO is too painful. We've blasted all those theories.
Gotcha. That's great. So, what do you believe is the reason why, and you may have just discussed some of these already, but I want to reiterate it. What is the reason why there's a better doctor-patient experience overall? Is it because you can do more dentistry? Is it because you can do more procedures in a single visit? Is it because of the post-operative stuff? What makes this a great doctor-patient experience?
All of the above. From the moment they walk in the door and they say, I've never been able to get numb. And I say, well, let me try this. And you're going to raise your finger if you feel something. So number 1, the initial injection. Number 2, the post-op pain. Number 3, the efficiency with working on it. And I've had people just sit up and start crying like, I've never been able to get numb before you the first time. I've had doctors say, my partner was selling. I just bought him out because I learned TuttleNumbNow, and now I can absorb his entire practice in my practice. I've had dentists up in Washington. I go to visit up there, and this guy goes, TuttleNumbNow? Yeah, he goes, I use it every day, every patient. People in Yemen saying, we used to run out of anesthetic. Now we don't. We're getting people numb that could never get numb before. We're in the trenches in Uganda. Oral surgeons saying, all my dentists need to learn this. Like, this is really good. It's a better way to practice. And that's my passion. My passion isn't about making money on this. We've spent a lot of 6 years of no income on this as far as, as a way of life. I still practice from 3 to 5 days for the last 30 years. But my whole goal is to improve the dentist patient experience and to change dentistry. And I'm really passionate about that.
Well, that's really good. So let's discuss the actual kit now. So what do you get? How much does it cost? What does the cost per patient come out to? I know you mentioned $10 for the X-tip, but why don't you talk about the kit itself?
So the kit is so I don't have to go and lecture anywhere. I do not like lecturing. Okay. The kit comes with a introductory statement that says every once in a while something comes along that turns a professional field and completely transforms the industry. Then you've got a color booklet. It has frequently asked questions. It has an endorsement from a malpractice carrier. This guy, it talks about, once again, common questions. What happens if you don't do it right? Simplifying charting, that's a great thing. When my patient comes in, I ask my assistant, hey, what TNN number was she? She's a 5. So I start right out with number 5 instead of going on 1 through 4. So you streamline your chart entries, and it has a 10-shot protocol, which is pre-prioritizes the shots based on the patient, and special considerations about elderly children, points to remember, and then the 50-minute video segments where if you wanted to go back and review troubleshooting or second molars or anteriors, or if you wanted to position angulation retraction, there's a video showing each of those. It introduces the products, gives the product code numbers, where to buy them. My goal was not to sell a bunch of products. My goal was to get dentistry changed. So if they buy this kit, it's a one-time purchase for $490. That's 2 bent needles, 7 times 70. There's kind of some religious component in there too. I would say, as the great physician is God. 7 times 70, $490, and then you get sample needle guides. You get the thumb drive that you can watch the videos. You get the new incremental syringe, and you get some of the needle samples provided by Septidon. So it's everything you need to get started. Once you have that, what is a recurring cost? If you can get a box of 100 needle guides for $35. Anyone that buys it, I would probably throw one of these in today, but you get 100 of them, where X-tips were like $10 a pop. This is 100 of them for $35. So it's trying to get it mainstream, and you can use it every patient every day. That's basically the kit.
Okay, perfect. So before we switch over to the lightning round Q&A, is there anything else that you wanted to mention about the product, about anesthesia, anything that you want to let the listeners know?
I'm one of you guys, man. I've been in the trenches, and I am still in the trenches every day. You guys, I'm doing this for you, and I hope you embrace it, enjoy it, and benefit from it. They said, how are you going to monetize this? And I was like, it's a video. People can copy it. I was like, I've already monetized it. I've monetized it for 20 years on, I've never advertised. And like I said, I've tripled the income on 3 practices that I've acquired, tripled the net income just from doing this. So I want you guys, I see these associates coming in that can't numb. I see people that can't numb and patient bad experiences. I don't want any of those to happen anymore.
Perfect. All right, so let's switch gears here. As I mentioned to you, and I'll mention it to the listeners and viewers, I do a little section here called Pod Deck. So I'm going to ask Greg some questions. Lightning round, Greg, real quick. So I'll read you the question, answer it as fast as you can. You don't have to go into long, drawn-out answers, okay? What book should you go back and reread as it made a great impact on you the first time?
There's a handbook on anesthesia that is written by Nustain. That's really good with cases, and it's up to date. It was published in 2016, I believe. It's a green book.
If you lost everything you worked for tomorrow, what's the first step in starting over?
Circling my family around, gather them around, team effort. And even if I still had them, I'd still have everything.
Okay. What has been your most satisfying moment or problem you solved with your business?
My most proud moment was when I was hooding my son at his dental graduation, and I had videos from my iPhone ready to train him on something that he would never have. And the spirit told me, basically, you're going to train your son, but what about the rest of these dentists? They're not going to know how to do this. And that transformed me to do whatever hazard to just go ahead and get it out there. That was my moment.
Oh, that's great. Do you have a hard time telling people no?
I don't have a hard time telling people no. I have a hard time when people tell me no. Because they say, you can't, you'll never be a dentist. You can't bend a needle. You know, that's what I have a hard time with. I'm like, forget it. I've been doing it. Yeah.
I like that. Who has been your greatest inspiration?
Jesus Christ. I mean, Tim Tebow moment, you know, I don't know if that'll get edited out, but it's true. And all glory be to God, basically. Yeah.
What piece of advice would you give to new college graduates who want to become successful entrepreneurs?
Entrepreneurs is find a mentor and latch onto them and listen to the advice of the senior mentors, because they'll tell you, like Glick told me, don't touch a needle. And so I came up with the needle guide. I had to develop the whole thing because I listened to him. He treated 3,000 AIDS patients in his time where he couldn't touch a needle. So he helped me by his advice.
How do you define success?
Success is a journey. It's not what you have, it's what you become. So you should become kinder, gentler, free with your knowledge. You should become more refined. My wife helps me accomplish that, my children as well. And of course, every day it's a quest to become better, to improve and become better.
Perfect. Last question. If you had a chance to start your career over again, what would you do differently?
Wow. I don't think I would have done anything. I couldn't have written the scenario as far as my house, my family, my career. I feel like I've been really blessed, and I'm just thankful for every bit. I have no regrets, and I'm thankful for everything. The future, I would like to know that. That'd save me some steps. But,
I think we all would. So, but that's great.
Len, when I met you, like there was a connection, and I just appreciate it. Like, you have so much experience in dental, and your reach is so far. Like, I could talk to patients, I could try to get it out. I have few followers on Facebook, and I'm never going to get it out. Something like this, you impact a lot of people, and you've really helped a lot of people, not only in their practice with Bird Eye and all your other stuff you do, and in being a dentist, but you're still working. You don't need to work, and you're still doing this and helping get it out there and improving dentistry. So I really appreciate that, Len. I really do.
I appreciate that too. Thank you. Greg, if people have questions and they want to learn more about the product, what are some ways to get in touch with you, get in touch with, the product? How can they purchase it? Go over that again, and throw out that offer again for people so they know.
Yeah, TuttleNumbNow.com. You can go on there. There's testimonials, ways to order. I only have 3 products that I sell: the syringe, the needle guides, those are replacements, and the kit. They can order there. If they want information, they can reach out. There's info@TuttleNumbNow.com, and we can get you more information. We have studies. Some people ask, what about the published studies? Those are forthcoming. But I say flip phone, iPhone, you put it in your hand, you get it to work, and the studies will happen when they need to happen. But there have been extensive studies from the top down.
And the offer was, you mentioned the Raving Patients podcast, and you'll add in a box of 100 needle guides for any purchase?
Yes. We'll give you, normally, you get a sample pack of 10 to see how it goes. And then people order the box 100 later, but to save you shipping and everything, you order it off of Raving Patients, and we'll throw this right in the kit, and you'll come ready to go. Yeah, it should take care of you for quite a while.
Well, this was awesome, Greg. Thank you for joining me today. Guys, if you like the episode, please share it. If you want to learn more about TuttleNumbNow, please reach out to Greg and his daughter, Jill, who runs the back end of the company. And let them know you heard about it on the Raving Patients podcast. If you want to purchase it, it's $490, and they'll add in a box of 100 needle guides for you as well. Greg, this was awesome. Thank you so much for joining me. But if you liked the episode, please share it. If you, liked it, please subscribe. Please, download it. Make sure you're getting reach out there. Review us, like us, check out the sponsors, both Cloud Dentistry and the doc sites. So please check them out. And I am so glad you joined me today, Greg. Thank you so much. And as I always mention on these episodes, and I end them, remember, your reputation matters. Until the next episode, Greg, thanks again for joining me, and we'll talk to everyone soon.